Hi, my name is Elizabeth Knoble, and I am a physical therapist here at Ladybird Physical Therapy in Austin, Texas. I wanted to talk a little bit about pelvic organ prolapse, as this is one of the things we most commonly see. We work with the birthing population, and most pregnant and postpartum people have a lot of questions about pelvic organ prolapse. I think the narrative of pelvic organ prolapse is really common in this birthing community. However, a lot of times we hear the main treatment option being surgery. And I want to talk about an alternative option for someone who's not a candidate for surgery or doesn't want surgery. Not everyone with pelvic organ prolapse has to have surgery. People that are stage 2 to stage 3 can manage their symptoms on their own through the use of a pessary. I wanted to talk a little bit about what a pessary is today and then answer some common questions that I see in my practice. Number one being, okay, so what is a pessary? What is this device? What does it mean? I've never heard of it before. What kinds of pessaries are there? Who's going to benefit from a pessary? Am I someone who might benefit from a pessary if you're a patient at home watching this or thinking that you might have pelvic organ prolapse? How does a pessary work? How does it help support us? What does getting fit for a pessary look like? And then how do I care for my pessary once I have it? What are my options long-term surrounding that care there? So in terms of what a pessary is, the most common question is a pessary is a device made of silicone that has a spring device that you insert vaginally that sits at the top of the vaginal canal to help support the organs where they should be. A lot of times when we have pregnancy or birth, organs can kind of shift based off of the changes in intra-abdominal pressures, and we want to make sure that they sit supported where we want them. So what a pessary does is it helps sit up at the top of that space to help support our organs where we want them to live. What kind of pessaries are there? There are multiple different types of pessaries. The main type of pessary is a support pessary. This is going to be a ring of silicone that you insert, and it sits in that same position that I spoke of earlier, up the top of the vaginal canal, to help support both a cystocele or a uterine prolapse. We're not really using pessaries to help manage a rectocele, which is when your rectum starts to move into the vaginal canal. More so, we're using a pessary to support bladder or uterine prolapse. A support pessary is a ring, and then you can add different parts to that ring to support other areas. So the ring itself is going to support the uterine prolapse. If we add any type of additional support to that, so a ring with support would be the name of that type of ring, it's going to support the anterior aspect, so more of the bladder. And then if we add a knob to that, it will support the urethra, which is for people that are experiencing leakage with higher intensity exercise or coughing, sneezing, something like that. A lot of what the questions surrounding pessaries that I see in my practice is who is the right candidate? If we're looking at anyone that's pregnant, postpartum, or perimenopausal, postmenopausal, and they're having symptoms described as a dry tampon feeling stuck in their vaginal opening, pressure downward on their perineum, leaking with coughing, jumping, weightlifting, anything that's increasing intra-abdominal pressure, then there's someone I really kind of want to talk about. Is this the right option for management of those symptoms? If someone has leakage with coughing, running, weightlifting, we can provide a pessary with a knob to help support the urethra if that's appropriate. Someone whose symptoms worsen when they're on their feet for long periods of the day. Some jobs don't allow for us to get off of our feet. So if a pessary is something we can use to support, then that is something that can be really helpful for that type of person. If someone needs extra support while healing postpartum, they don't have the resources to dedicate to strengthening right now, but they know that they're having this sensation, a pessary can be used to help support their organs while they're healing. If someone's postpartum with their second, third, fourth baby, they just need a little extra support while they're trying to do things with their toddlers, their kids. That's something that can be really helpful and a really good tool. And then I just like to plug in anyone that is restricting their activity or their life because they're scared or they're fearful or they're uncomfortable of their prolapse. That is something that a pessary can really give you back, can really encourage you to be the person that you want to be, to do the activities that you want to do that make you feel like you. How does a pessary work? So what a pessary does is it is inserted into the vaginal canal, and it just reorients and helps support all of those organs that are starting to collapse into the vaginal canal because of shifts in intra-abdominal pressure and changes in any structural support, be it ligaments, whatever has kind of shifted because of pregnancy or birth and delivery. That device stays in there and helps support while we work on strengthening your pelvic floor underneath. Your pelvic floor is going to support from the bottom. The pessary allows for your organs to be a little bit more supported and not put so much pressure on the pelvic floor. So the pelvic floor can really focus on strengthening and being that happy, healthy tissue that it really needs to be. What does getting fit for a pessary look like? So at our clinic, being a physical therapist, will have my initial evaluation. So my initial physical therapy evaluation, where I'm talking to you about your goals, your plans, what you want to do, what your symptoms are, when you're feeling your symptoms, how you're able to manage your symptoms, how can we manage your symptoms together, all the good physical therapy things. However, if I feel like you are a fit for a pessary and you are someone that needs this extra support device, I will schedule you for a follow-up pessary fitting appointment. That will be our second appointment together or third appointment together, depending on when you feel like you're ready for it or when I feel like your body is ready for it from a tissue perspective. What the pessary fitting appointment will look like is you will come in and I will have you lay on the table. We'll assess your size by inserting 2 fingers, see what the determination for that is, and then I will insert a ring pessary that will be fit for you, so it will be determinate on your size. I'll have you stand up, I'll have you move around, do a bunch of activities, whatever activity could possibly be provoking to you, and see if that pessary helps with that. Make sure that it's not going to move or fall down. If it does, then we will insert a different size depending on what you're feeling. Does it need to be a size smaller or does it need to be a size larger? And then we will go from there. I will remove the pessary. I will then teach you how to insert the pessary. You will insert the pessary yourself to make sure you feel super confident with it. And then we will have a follow-up appointment after you have your pessary to make sure that there's no concerns in terms of tissue, usage of the pessary, removal, anything like that. How do you care for the pessary once you have it? So once you have your pessary, I want you using it in whatever way we talk about. So if you're someone that only needs it because you're having symptoms with running, then you wear it with running. If you're someone that needs it all the time, and you're gonna wear it all the time and then take it out at night. So I have my patients take it out nightly, just to make sure that those tissues are getting a little bit of a break from having that pessary sitting in there. In terms of cleaning it, I tell people to clean it with mild soapy water, warm water, 10 to 15 minutes. And then if you need to sterilize the pessary, boil it for 10 to 15 minutes in boiling water, and that will sterilize the pessary. So if you drop it on the ground or something like that, you don't have to sterilize it just preemptively. I do recommend removal for sex as well. However, if you're someone that is feeling like the pessary is a good idea for you, you can wear it in sex. There's not a contraindication necessarily with that. You can wear a pessary on your cycle. That's not something to be concerned about. So that is something I will have my patients do, especially if they're symptomatic closer to their cycle. With my patients that are caring for pessary, that have one, I like to follow up with them monthly to make sure that everything is good, moving in the right direction, and that we're strengthening as well. Once they've had the pessary for about 6 months, I'll shift them to a 6-month follow-up basis. If they're following up with their OBGYN, they don't necessarily need to be following up with me as well unless they're still trying to achieve their functional strength goals, all of those things. However, one provider needs to be paying attention to the management of this pessary just to make sure that your pelvic floor is still happy, healthy, and there's no risk of any type of changes in the tissue, and making sure that that's not something we need to address. If you feel like you are a good fit for a pessary, then come see us at Ladybird PT in Austin, Texas. We can talk you through all of the things that I mentioned and how this can help you and get you set up with one today.